Ladies and gentlemen, fans and audience of the Saudi 2 channel, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. I welcome you from the Saudi 2 studios in our 4th episode from the health show. As we all know, obstetric or pregnant ladies are of a great importance in the community, and as we know also, during Ramadan they might have many complications and many health issues that may concern them. And in order to make sure that the pregnant lady keep her health in a good way, and also make sure that she preserve her fetus or preserve her baby, we chose this topic in order to stress some importance on their health and make sure that they get the important advices and tips along with fasting, and how can they cope with fasting and make sure that everything is going fine. That's why we chose this topic, and here in the studio I would like to welcome with me Dr.Hiba Sarhan. Dr. Hiba Sarhan is a consultant of obstetrics and gynecology. Welcome to the studio, Dr. Hiba. Dr. Hiba, as you heard our introduction, we chose this topic in order to stress some importance on pregnant ladies and how can they cope in Ramadan. The first question that comes into our mind, and everyone in the audience probably, is that can pregnant ladies fast, and if they can, who are candidates for that and who are not?
Actually, pregnancy will be safe for pregnant women if they were strong enough and well enough to do so, and if their pregnancy is going on well. If their weight and lifestyle are healthy in general, they can do this and they can cope with fasting. But if they are not feeling well or they have any medical problems that can harm their babies if they fast, they should talk to their doctors. Actually, pregnants can fast if their general health is good. If they have any problem, they should talk to their doctor and to Islamic sheikh that they can consider their options. We have some high-risk groups of pregnants. They can't fast, or at least if they will fast, they will be under supervision. We can talk about anemic pregnants, about diabetic pregnants, any pregnant with history of preterm deliveries, any pregnant with bleeding, especially less than 12 weeks, IVF pregnancy in their early stage, twin pregnancy in their late stage. Also, if the patient is vomiting, especially in the first trimester, if she is dehydrated, she can't fast also. Anyway, if there's any medical disease that this pregnant have, she should counsel her doctor before she fasts.
So always we advise to counsel the doctor or the physician before she starts fasting.
Yes, and she will consider the options with her doctor and an Islamic sheikh to have the special permission, especially that she should not ignore that she has special permission in Islam.
We do know that in Islamic Sharia there is some exceptions for pregnant ladies in case their health is in danger, and as we know, all know darurat tubih al-mahdurat. Therefore, I believe she should, as you said, counsel an Islamic sheikh. However, may I ask you this question out of curiosity, since I have a medical background. Is there a specific time, let's say we know that pregnancy is 9 months in total, or 36 to 40 weeks. Is there any specific time where usually fasting is not recommended, let's say in the early first trimester or in the third trimester, in the early 3 months or in the last 3 months or in the middle? As I know from my background, and you are the expert of course, and we want to get the benefit from your expertise, usually in the middle trimester or the second trimester, the pregnant lady is, let's say, in the safe period of time. Usually the first and the third are the ones with the most complications. Is there any time that she should be concerned of, or is it all based on the clinical judgment?
There is a lot of studies and statistics about the outcome of pregnant during the fasting in each trimester. Some studies told that the first trimester is the more dangerous, but actually we have a basic that the baby needs nutrients from her mother, and if her body is strong enough and she had good energy stores, she can fast and she can cope, and the fasting will have a little impact. It's not related to the trimester, first or second or third. It's related to her storage of energy.
So it's not related, it doesn't have to do anything with fasting in her early pregnancy or late pregnancy. That's great to hear, probably, and for the audience also to hear. We'll stop with this report and we will come back to the studio after it. Stay tuned. Assalamu alaikum. And now from King Faisal Specialist Hospital and Research Center, we have Dr. Wesam Al-Kurdi. Dr. Wesam Al-Kurdi is an associate professor at Alfaisal University College of Medicine, and she is the section head of the Maternal Fetal Medicine Department of Obstetrics and Gynecology at the King Faisal Specialist Hospital and Research Center.
Bismillah ar-Rahman ar-Rahim. Usually, pregnant women are healthy ladies. So, in the majority of cases, a pregnant mother can actually fast during Ramadan without having any concerns or health concerns. Although this does not apply to everybody, obviously, and even normal pregnant mothers, we know that they're at more risk of having some issues during their pregnancy and maybe specifically during Ramadan. They are more likely to have, for example, feeling tired. They might have some swelling of their limbs. They are more likely to have constipation. They are more likely to have headaches. So all these are some concerns that they might actually face during normal pregnancy and during Ramadan. We'll come back to the normal pregnant woman towards the end, but now let's focus more on diseases, on mothers that might have some medical problems, and these might put them at a bit of more concerns or more risks during pregnancy. Let's start off by one of the common diseases that we actually see in the country, which is diabetes. Diabetes, we know, is a major health concern in the whole Kingdom of Saudi Arabia. And for sure, we do see a good number of actually pregnant mothers with diabetes, whether this diabetes is actually present before they are pregnant or if it appears for the first time during pregnancy. These particular women, it's extremely important, especially if they were on insulin or on medications before Ramadan, that they need to go and see their healthcare providers or their obstetricians just to make sure that they are receiving the appropriate dose of their medication, the appropriate timing of the medication. Maybe they need even to see the dietitian in order to adjust their meals during Ramadan. Because one of the concerns that they might have is hypoglycemia. They might receive a big dose of insulin, and obviously they will be fasting, so they might just have their blood sugars dropping, and this is definitely quite serious for the mother and for the baby. On the other hand, she might actually have hyperglycemia or increased blood sugar levels because she is worried she might reduce her insulin dose because she doesn't want to go into hypoglycemia, so she might actually rebound into the other direction and have hyperglycemia. So both are quite important, and therefore it's extremely essential that she actually adjusts her insulin level, she adjusts her diet, her meals, try to eat small frequent meals between iftar and suhoor. Obviously, if her blood sugars are not very well controlled, then maybe fasting is not really the thing for her. So she has to actually keep a close eye on that problem. One of the other problems that we actually face also, which is quite common in pregnancy, maybe 7 to 10% of pregnant mothers have, is hypertension. And this could be hypertension before pregnancy or hypertension that develops during pregnancy. So again, especially if she has hypertension before pregnancy, then she might be on like multiple medications, or she might have even other organ involvement such as the kidneys. So she definitely needs to see her healthcare provider before Ramadan in order to adjust her medications, to know what is the appropriate dosages that she needs, what are the appropriate timing of her medications, in order to avoid both hypotension and hypertension, and both are quite serious. If she develops these problems or her blood pressure is not well controlled while she is on during the fasting hours, then maybe again fasting is not the thing for her. So she really needs to go and consult with her physicians. And in general, for normal healthy pregnant women, because Ramadan these days comes during the summer and it's quite hot and it's long fasting days, so she is more likely to develop things like dehydration, for example, that because she's not getting enough fluids. So dehydration might actually result into feeling headaches, feeling tired, maybe even reduced fetal movements. She might actually even have some contractions in the uterus because of the dehydration. And therefore it's the general good advice to these pregnant mothers is to make sure that they eat frequent meals from iftar to suhoor, drink plenty of fluids, at least 8 to 10 glasses of water in between iftar and suhoor. Try to have some rest during the day, try to avoid being in very hot areas or hot climates, and for sure try to take care of herself and to take care of her unborn baby. And I wish everybody like a nice fasting and Ramadan Kareem to everybody.
Ladies and gentlemen, welcome back. And here with us in the studio we have Dr.Hiba Sarhan, consultant of Obstetrics and Gynecology. Dr. Hiba, that brings us to the next question, which is what lifestyle modifications should a pregnant lady take in general when she decides to fast, and if she has a good health condition, as you said earlier? What lifestyle modifications, including her nutrition, her diet, daily physical activity, that she should take care of in order to achieve both, getting essential nutrients and making her health and the fetus, making sure the fetus health and her health are okay, and at the same time keep fasting in Ramadan?
Actually, first you will tell the pregnant woman, if you are used to have a lot of drinks, caffeinated drinks like tea, coffee and cola, you should cut down before you start to fast, so you will prevent the withdrawal headache during fasting hours. Secondly, you should take plenty of water, plenty of liquids during at suhoor and at futur time. Plenty of drinks, this means that you will not dehydrated. Try to avoid taking a very high, a lot of sugary foods that will raise your sugar very quickly, and the sugar also will drop very quickly, and this may make you faint and dizzy. Try to take healthy food, a lot of vegetables, high fibers, so that will prevent constipation. Try to have at futur, we can tell this, the complex carbohydrate which will release energy very slowly, and this will help you to go on more, and also will stop constipation or prevent constipation.
We already talked in our previous episodes about constipation, and probably if the audience, they watch that episode, they would have a good idea. But my question, probably a lot of concerns I keep hearing, even in non-pregnant women, in pregnant women but not in Ramadan, is that they keep having UTI, urinary tract infection, and they have burning sensation during urination and whatsoever. How can we prevent this in Ramadan?
Plenty of drinks at suhoor and at futur, because dehydration will make the pregnant more prone to have UTIs, with urinary tract infections. And also I encourage all pregnant to break their fast on hot drinks or on hot tea, hot soups, and to have the food slowly, so because the stomach already is smaller than it was, so the pregnant should eat slowly, and she should break her fast only by hot water or hot tea, herbal tea or hot milk.
Okay, Dr. Hiba, the next part of the question is the physical activity. We all know that we recommend to pregnant ladies usually that during pregnancy try to limit your physical activity, but in Ramadan probably they should make sure that they are limiting their physical activity, since, as you said, they have, for some time of the day, they have limited storage which was taken previously. So what do you recommend regarding the physical activity in Ramadan? Should they decrease it? Should they be more aware of it?
For pregnant women, she should take things easily. Try to accept all help as it's offered. Try not to walk for long distance. Try not to carry heavy things. Cut down your housework. Try to leave all work that make you tired out. So try to limit your physical activity, so you will limit your calories burned during the fasting hours. So you will use your storage only for your baby.
I see. Okay, we'll stop with this report about nutrition and essential intakes for pregnant ladies and obstetrics, and we'll be right back. Stay tuned. Dr. Razan, today our theme is about obstetric patients and pregnant ladies in Ramadan. Can you please provide us with a nutritional advice from your expertise about how a pregnant lady can take the essential nutrition she needs for the development of her baby, and at the same time she can maintain fasting?
Okay, first of all, happy Ramadan to all. It's my pleasure to be here with you today. I'd like to talk about the pregnant lady. She has to think about herself and her baby as well. So if she would like to fast, it is okay if she fasts. If she is following a healthy lifestyle, because this will be also good for her and for her baby. So I would like her to focus on having a balanced diet. For example, she should follow the guidelines of for example, the United States of Agriculture, the pyramids, or now it's improved into My Plate. She can follow this guidelines, for example, to eat from all food groups. For example, we can mention these groups, the carbohydrates, and she should focus on complex carbohydrates, because complex carbohydrates will provide her with energy that is needed for her growing fetus, and also it will also provide some fibers that prevent any constipation that is common for pregnant lady. And also she can have the second group, she can also focus on protein. Protein is needed for building the new tissues for the baby, and also focus on dairy. The dairy has a lot of calcium and vitamin D, and it's very much needed for her growing child, baby, and for his teeth, and also to preserve her bones and minerals. Also, she should focus on having good amount of nutrients through fruits and vegetables. And of course, she has to pay attention to the amount of fat she is eating, because the fat is good and it's needed for for her, but she should focus on the type of fat. She shouldn't overindulge in fat, and stay away from fried foods, stay away from heavy meals, and just be limited to the good kind of fat, such as olive oil or vegetable oil or nuts. It's very important also to focus on nuts, because nuts are very healthy, and they can provide her with some essential nutrients she needs, and also some fibers and some protein. So this is basically what I advise these pregnant ladies to follow during Ramadan. For example, I can give you also I need to stress also here on a very important point, which is drinking enough water, because in this season Ramadan is long and it's hot. So not having enough water or hydration, this will affect the baby, and this will put the mother into dehydration, and this can be dangerous for the mother and for the fetus. So it is very important for her to drink a lot of water, at least 8 cups of water a day, and to stay away from caffeinated beverages such as tea or coffee. If she is addicted to coffee or tea, she can start before Ramadan by reducing the amount she's taking, and she can have as much as 200 milligrams of caffeine a day, which equals around roughly 2 cups of instant coffee. This is allowed, by the guidelines. Also, some nutrients are very important. As I said, calcium. Calcium is very important. She can find it in dairy, but I'd like her to focus on low-fat dairy products, such as low-fat yogurt, low-fat milk, low-fat also cheese. 1 cup of milk can provide her with 300 milligrams of calcium, and her RDA, or recommended dietary or daily allowance, should be not more than 1,000. She can have 1,000 and it could be enough for her. Also, she has to focus also on iron. Iron is very important for her. Also, iron is found in legumes and in red meat and in all kinds of meat. Also, it's found in green leafy vegetables. She also needs folic acid, also found in vegetables and some nuts. Choline. Also, fibers are very important. As I said, she should stay away from constipation. Also, you wanted to ask me something?
I would like to know, Doctora, what's the plan you would recommend for breaking the fasting and then for suhoor, especially that we know in Ramadan the patients, they have issues with usually they have heavy meals at the breakfast and at the suhoor.
Problems in indigestion and so on.
Exactly.
Okay, so I would like her to, because of the baby inside her, the room for the stomach is much smaller, especially if she's in the end stage of the pregnancy. So it's better to have small, frequent meals. So she guaranteed that she doesn't have any problems with digestion. The meals should consist of, as I said, it should be balanced, it should be healthy. She can break her fast with a very light meal that includes some dates and some leban or water, and then she can start by eating her main meal or main futur by eating salads, by eating some soup, vegetable soup or lentil soup, which is high also in iron and fibers. Also, she can have some small amount of rice or bread or some baked pastry filled with meat or vegetables, also fish, also any type of protein that she would like, because protein is very important also to have. And stay for a while, for like 2-3 hours before she has another snack. For example, dried fruits is very important also for her, because they provide her also with iron and a lot of nutrients, mostly iron and fibers, and also the energy for her to keep her going. Also, she can have like a light snack in between the futur and suhoor, which can consist of some nuts or a small sandwich, or maybe some vegetables or fruits. Also at suhoor time, she can have a very light meal, including fruits, leban, yogurt, some dried fruits, maybe a sandwich, maybe eggs. Also, boiled egg is also very important, but we should also be careful of eating eggs that should be very cooked well cooked, because pregnant women are prone to have more bacteria infection. Usually this is what I advise pregnant women to have. The nutritional advice is to be careful, not to miss meals. Because they need the food is needed for her strength and her health and for the baby. So she should focus on really eating healthy. She should focus on getting hydrated very well, and she should have a lot of rest. She should avoid having dehydration or staying out in the sun, and focus on her needed nutrients. Besides, if she wants to take multivitamins, it's okay also, but she shouldn't only rely on the multivitamins. She should also take the vitamins from its original sources, which is the nutritious fruits and vegetables and protein.
Ladies and gentlemen, audience of the Saudi 2 channel, welcome back. And now here with me Dr.Hiba Sarhan, consultant of Obstetrics and Gynecology, and our theme today is about obstetric or pregnant ladies. Dr. Hiba, we almost covered two important parts about lifestyle modifications and who are candidates for fasting. My next question to you is what modifications in supplements and drugs should a pregnant lady take into consideration? As we all know, some pregnant ladies, sometimes they are on either essential nutrients, supplements, or sometimes they are on drugs due to some health issues or due to threatened pregnancy. How can they adjust the timing of their drugs and the doses before Ramadan or probably during fasting?
Actually, for drugs that are taken for medical disease, should be discussed with her doctor, the doctor of this specialty. And if this drug must be taken, maybe she should not fast even. But from obstetric view, like if she's pregnant and she's like only taking essential supplements, as you told, she just will take her supplements after futur. It depends on her habits. Yani nothing, no change in doses, no change in her timing. Just on the break time she will take it, and the fast time not.
Yani as all other, probably we also discussed this in other episodes, such as in diabetics. In all patients, if they have a morning drug, they will take it at breaking the fast, and when they have a night drug, they will take it just before.
Like hypothyroidism, she will take it while she's breaking her fast. And it depends also on the disease and drugs, and she will counsel her doctor.
Same goes for supplements and everything else. Okay, my next question, Doctora, is how often should she monitor her status? We all know that there is a schedule probably for pregnant ladies. They have follow-up appointments. And in Ramadan, is it important to modify this schedule, or should they go with the same schedule, probably one visit per month or per 2 months, and it depends on her status?
No, for pregnant, she will go for her antenatal care visit as usual. If she is on 32 and above, she will go every 2 weeks. If she's 36 and above, she will come every 1 week. If she's less, she will come every 1 month. Unless there is any signs that she should counsel her doctor or she should contact her doctor. But her antenatal care visit should keep on the same way before.
So probably, as we said in the beginning of the episode, just before she starts fasting, that's the important visit, is that she counsel her physician or her specialist and make sure that she's fit for fasting. That's great. Okay, we will stop with this report and we will come back to you. Stay tuned with us.
Since the first moment of ladies being pregnant, the moment that changed ladies' lives over years, mothers of the future start to care about themselves, including their health, food, body, and their unborn babies, especially dealing with their pregnancy and breastfeeding after delivery during fasting in the holy month of Ramadan.
I want to say that fasting is one of the pillars of Islam, and everyone he must fast in this month, but there is exemption, and one surah in Quran, Surah Al-Baqarah, there is clear that there is permission for those who are sick and travelers. So the pregnant woman and the breastfeed baby, if she can fast and she can feel that she is strong enough and the well-being is good, she can fast. But if she has anything in her baby or in her health, she cannot fast.
According to some studies, it shows that fasting in pregnancy appears to be safer for the mother and her baby, and that's according to what she feels, because if the mother feels herself strong and well enough, and if her pregnancy is going well, after that she can fast.
The problems in Ramadan, especially this Ramadan in summertime, and there is dehydration, very hot, and the day is long, and she must regulate that. If she feel that she is not good, that she is not well-being and her baby in danger, she cannot fast. But if she feel that she is good, she can fast, and she can take regular, she can be calm and in cool place and take rest. She arrange the work that she is not tired. If she feels she is tired, she can cut her work and arrange for rest.
Some stories say that fasting is not expected for the breastfeeding mothers because babies will be used to mother's milk changing a little already, depending on what she eats and how much the baby needs to feed. The breast itself is thought to be able to make some milk fats. Other types of fat will come from mother's own fat stores if there is not enough in their diet.
At the start, if it is a newly born baby, she cannot fast. Till 40 days, she cannot fast. Because she is in puerperium, and she can fast in another time. This is permission from God. And this is because the milk it's also related to the food she take. If she is fasting and it is hot weather and every 2 to 3 hours she must feed her baby, this is she cannot fast. But if the baby he can eat another things, she can fast.
Mother's decision may be guided by the age of her baby. A baby who's tiny and exclusively breastfed has different needs from the 1-year-old, who eats other foods and only breastfeeds at night. Most Muslim scholars believe that pregnant and breastfeeding mothers have permission to fast during Ramadan to preserve their health and their babies. For the Health Show, this is Nida Aude, KSA2, Dubai.
Gentlemen, welcome back to the Saudi 2 channel. Here with me in the studio, Dr.Hiba Sarhan, consultant of Obstetrics and Gynecology, and our main theme is pregnant ladies, as we said earlier. Dr. Hiba, now we go on to a very important question. As we all know, pregnant ladies, they might be completely fine and healthy, and then all of a sudden there might be some changes in their health or due to their pregnancy, and we will have certain type of emergency sometime or symptoms, some alarming symptoms, and they will need to seek medical attention instantly, or sometimes they might need only to visit up, follow up their physicians, such as we know sometimes blood spotting, abdominal pain, several symptoms. What are the most important alarming symptoms that a pregnant lady should take care of? And usually they are related, as from your experience, to Ramadan, if any. And when does she need to visit the emergency immediately or make a follow-up appointment with her doctor?
Okay. For her antenatal care, routine antenatal care, she will come as usual. But if she had any new signs that she should counsel before, like she's not gaining weight or she's losing weight, if she had any sign of dehydration, like she's not passing urine frequently, this is a sign of dehydration, and this will make her more prone to have urinary tract infection. If she had any sign of urinary tract infection, like urinary burning, dysuria or hematuria, she should also contact with her doctor or come to visit. This is the signs that related to pregnancy and fasting. And also she will come to follow up her doctor if there is any signs not related to fasting, like contraction, like blood. But the more important sign that she should come if she feels too much dizzy, too much headache, and she's drowsy and not concentrating, she's dehydrated. Especially dehydration is the most common symptoms within fasting pregnancy.
Okay, Doctora, can I ask you what are the most common complications generally, not from usually related to Ramadan, because I don't think anything is related specifically to Ramadan. What are the most common complications that you usually see in your clinic in pregnancy, such as I keep hearing that the diabetic, as you said, diabetic pregnancy, or they might have hypertension. What are the most common complications, and what are the most serious and the less serious, just for the increasing the public awareness for our audience?
Actually, in our country, the most common complicated pregnancy is the diabetic pregnancy, diabetic pregnant, because of the lifestyle and can tell the not healthy diet. Secondly, we have the hypertension, also related to lifestyle and not healthy diet.
Okay, and how do you usually manage each, especially the diabetic, because diabetic, as you said, is the most common. How do you usually manage it? Is it by medication, lifestyle modification, or both?
Actually, it needs both, but firstly we will start with lifestyle modification and diet. We will have cooperation with the dietitian and also the endocrinologist. And the diabetic clinic, they will also coordinate to have good diet, and the patient, if she's doing this diet, mostly she will control her diabetes. But if she didn't control, we will go to insulin during pregnancy. We can't use only insulin to control diabetes.
Only insulin. So probably glucophage and other types
No, it's not recommended during pregnancy.
And also, since we mentioned this point, that brings me up to another question. That brings up another question: the medications. Usually, pregnant ladies, we keep saying keep watching or having patients that come and they start taking drugs just randomly, although they are pregnant, and they don't know that usually there is some categories of medications that are prohibited. Can you just tell us generally, of course we can't specify all types of medications, generally what are the medications that she should take care of? And of course I would really stress probably, and after you, that they need always to ask their physician about the medication. Just can you tell us briefly about the types of medication they should be really aware of?
Actually, the most dangerous medicine is the vitamin A complex that's available in Derma clinic. This is the most dangerous. But anyway, all the medicine, the patient or the pregnant should counsel her doctor before, because there is some medicine that is dangerous in the first trimester, not dangerous in the second, or the opposite. It depends on the trimester. It depends on her case also. So any medicine she will take, she should counsel her doctor before. Unless if she will take folic acid, this is the only medicine we recommend the patient to take it 3 months before pregnancy. Otherwise, all medication she should go back to her doctor. Because even antibiotics she should go back.
Because probably from your expertise, you know more than I do, the patients, they assume that some medications are just not harmful, they are harmless, and specifically the derma types and the creams and whatsoever, and they start taking them just in a haphazard way, and they don't know that usually these types of medications, they might have consequences, bad consequences on the baby and on her pregnancy. And that's why I wanted to stress on this point and ask you from your expertise, in order to make sure to the audience that they know about this. Doctora, can we now, since we discussed almost everything important about pregnant ladies, can you just give us a small summary about the important general recommendations for pregnant ladies?
Okay, for all pregnant women, I'm telling you that during Ramadan, if you are well, you are strong enough, fast, you should fast. But if you are feeling unwell, just counsel your doctor and any Islamic sheikh to consider your options. In Ramadan, try to have plenty of water, plenty of drinks, don't miss your suhoor. Try to break down with hot water. Try to limit your physical exercise just to have a lot of energy stored for you. And finally, follow up your doctor, your antenatal visit, and follow up with your doctor if you have any signs, that dangerous signs as we mentioned before.
Okay, Doctora, we will stop with this report and we will come back to conclude our episode. We will be right back, ladies and gentlemen. back, ladies and gentlemen, and back here in the studio with Dr. Hiba Sarhan. Dr. Hiba, just before the report, gave us the most important general recommendation. And now, since we're almost coming to the end of our episode, we would like to just highlight again everything question by question, just to make sure that the message is totally delivered to our audience. So the first thing we asked is about obstetric patient fasting in Ramadan. Can they fast or not? And Dr. Hiba, you said that they should always get back to the physician and make sure that they counsel you before or counsel the physician or the specialist before starting fasting, and then if it's fine, they can go along with it. And as you said earlier, we don't have to, it's not related to any part of the pregnancy, either the first 3 months, the middle 3 months, or the last 3 months. Would you like to comment on that, or is that totally okay? And then we came on to the next part, which was the lifestyle modifications. And then you told me about the lifestyle modifications that, as you said also in the conclusion before the report, is that we need to stress on that pregnant ladies, they don't exercise too much, they take care of themselves, and also take the essential nutrition they need. Make sure they hydrate themselves very well, make sure that they eat healthy food, fibers, in order to avoid constipation, urinary tract infection, and other complications. Then the third question, which was the modifications in the drugs, we said as all other categories or all other patients, she should modify her drugs to be and doses as the same doses, just modify the timing, either in the time of the breakfast or at the time of fasting itself, just before fasting. And then we came on to the fourth question, which was an important question, is that how often should she visit her physician? And we said just keep up with her schedule. And this is a very important point. I would ask you, just as an interruption of the conclusion, is that some pregnant ladies, they miss their follow-up appointments. Can you just tell us briefly how bad consequences this can have on their health?
Actually, maybe your visit during Ramadan will be for scanning of the growth of your baby. If the growth of your baby is not enough or is not sufficient to its age, then we will not recommend you to fast, so don't miss it. Maybe this visit will be to check or for screening of glucose or anemia. Also, maybe you will have some glucose intolerance and you will ignore it until after Ramadan. Even anemia, it will increase during fasting, so don't miss your visit. Maybe it will be too much important even to take the option of fasting or not.
Definitely, and that's very important to stress on, that don't miss your visits, and especially the visit before Ramadan, as Dr. Hiba mentioned. And then we said some of the alarming symptoms during Ramadan and the complications, as you said, Doctora, earlier, is that she should make sure that she doesn't have dehydration, she doesn't faint, she doesn't...
She's not weak. Also.
She's not weak.
She's feeling weak, dizzy, fainting. She should stop fasting and she should talk to her doctor. What
about, if I can comment on, what about the activity of her baby, if she felt also?
Sure, this is very, very, very important signs. We forgot to mention that if you have noticed the decreased fetal movement, decreased movement of your baby, you should go back to your doctor. Maybe he will tell you not to fast. Maybe the baby is affected by your fasting. So this is a very important sign. Because
they keep, as we were taught during medical college, they keep relating that decreased fetal movement is related to decreased decreased supplements to the baby.
It's a decrease of his biophysical activity.
So probably it's not a good sign. They should take care of it, and they should be aware how much the baby compared to the first.
There must be some investigation, more investigations to check the baby, why the baby is not moving.
Okay.
Maybe it will be not a very big problem. Maybe you will keep on fasting, and maybe we will recommend you to stop fasting.
And finally, we came on to the question about the medications, that should pregnant ladies go with the medications or not, and we said that they always should counsel their physician before taking any medication, whatever this medication is, even if it's on over the counter or they can buy it from anywhere. Still, they need to ask if this drug goes along with their pregnancy or not. Okay, and from here I would like to thank you very much, Dr. Hiba Sarhan, consultant of Obstetric and Gynecology. Thank you very much for being here with us. I hope that the audience and everyone else have got enough beneficial information from your expertise and from your experience. Thank you very much, Dr. Hiba, for being here with us. And from here, I'm Dr. Anas Al-Khani. I would like to thank you very much and wish you all a happy Ramadan. Please don't forget to subscribe to our Facebook fan page and to our YouTube channel. Thank you very much, ladies and gentlemen. Assalamu alaikum wa rahmatullahi wa barakatuh.